Haidee and good afternoon. Thank you for joining us virtually for today's COVID-19 press conference. At this time, I want to acknowledge our panel. This morning, we have the Honorable Lourdes A. Leon Guerrero, Magahagan Guahan, Governor of Guam. We also have with us the Honorable Joshua F. Tenorio, Segundo Magalahan Guahan, Lieutenant Governor of Guam. We have our State Surgeon, Colonel Mike Cruz, Physician Advisory Group Chairman, Dr. Nathaniel Berg, Public Health Director, Art San Augustine, Public Health Interim Chief Medical Officer, Dr. Bob Leon Guerrero, Public Health Chief Public Health Officer, Chima Mbakwem, Guam Memorial Hospital Administrator, Lillian Perez Posadas, Guam Regional Medical City Chief Nursing Officer, Jen Cruz, and Dr. Annette David, Lead Epidemiologist for Guam State Epidemiological Outcomes Work Group. And at this time, I'd like to give Governor Leon Guerrero the floor for her remarks. Governor, please unmute.
Sorry. I first want to begin by thanking the people of Guam for your continued efforts to contain the spread of COVID-19. This deadly virus has tested our fight for nearly 2 years. These last few months have been especially devastating. While the Delta variant has provided a formidable enemy, we have not and did not surrender. Although the fight is far from over, today we recognize the progress we have made. As our territorial epidemiologist, Dr. Ann Pobitsky, briefed our public yesterday, we are encouraged by the continued downward trend in this third wave. Today we are reporting fewer COVID hospitalizations, fewer COVID cases, and fewer COVID-related deaths. Let me be clear. We are not here today to call victory from this virus. We can, however, begin to loosen our grip on the restrictions we put in place at the peak of this third surge by moving toward a responsible and gradual easing of restrictions. In consultation with public health, with the surgeon cell, with the physicians advisory group, the following changes will take effect. For restaurants and bars, effective 8 a.m. Saturday, November 20th, outdoor dining will be permitted regardless of a patron's vaccination status, subject to public health guidance. Indoor dining at restaurants and bars will continue to be restricted to patrons who provide proof of vaccination. All covered establishments must continue to comply with mask wearing, social distancing, and vaccination and testing requirements for staff who enter their premise. For social gatherings, effective 8 a.m. Saturday, November 20th, the indoor social gathering limitation will be increased from 10 vaccinated individuals to 25 individuals, regardless of vaccination status. And the outdoor social gathering limitation will be increased from 25 vaccinated individuals to 75 individuals outdoors, regardless of vaccination status, subject to public health guidance. For incoming travelers, individuals traveling from a foreign country must comply with the new federal requirements to board a flight and are further subject to quarantine at a government facility with the following exceptions. Effective 12:01 a.m. Saturday, November 20th, individuals may be exempt from quarantine upon presentation proof of full vaccination with FDA authorized or approved or WHO emergency use listing approved COVID-19 vaccines. This isn't a new exception to quarantine. What we are doing is aligning with the CDC international travel requirements and recognizing those that may have different doses of vaccines as being eligible for quarantine exemption. In addition, a valid negative PCR test result collected no more than 3 days prior to departure instead of the current guidance which states arrival will be accepted. We are adding a third way to avoid quarantine requirements, which is a valid negative antigen test result collected no more than 1 day prior to departure. And that means boarding a flight to Guam, as provided in public health guidance. With the holidays here, we must stay smart about when and what restrictions we choose to relax. Too much, too soon runs the risk of undoing the progress we have made. And as you know, CDC is currently studying the high rate of dead on arrival cases in our community. As always, we will continue to monitor our data daily and when warranted, make additional changes to our policies. Again, this is a responsible and gradual easing of restrictions because we know what is at stake. We know our frontliners are exhausted. We know our students need to stay in school. And we know our families, especially those who have lost loved ones to this virus, need to heal. We also have more fights ahead of us, which is why we will continue to urge our community to do the following. If you are feeling sick, please get tested. Testing ensures we identify new cases quickly, and it helps us stop the virus in its tracks. Testing ensures we get you the medical care and attention you need sooner. And most importantly, it saves lives because as we experience over the course of this third wave, too many arrived in our hospitals, dead on arrival, not knowing they have the virus. This leads me to my next point. Should you test positive for COVID-19, treatment is and has been available. To date, we have helped nearly 1,000 people get better faster. Monoclonal antibody treatment can be done as an outpatient service, meaning you don't have to go to a hospital to get this care. In fact, this treatment keeps you out of the hospital and has lowered hospitalizations and saved lives. For more information on monoclonal antibody treatment, please call 671-998-4627 or 671-734-9203. Lastly, I want to urge everyone who is eligible to get vaccinated. If you have yet to receive your first dose, it's not too late to do so. Getting vaccinated now means you get the protection the vaccine provides. The goal is to starve this virus, and with fewer unvaccinated persons, the virus has fewer chances to survive. If you received your vaccine early on and it's been 6 months or more since your last dose, it may be time for a booster shot. If you are 65 and older, or you're 18 or older and are at high risk because of underlying conditions or where you live or work, please get your booster done. And if you are a parent or a guardian of a child 5 to 11 years old, we highly encourage you to get your child vaccinated. Again, our mission is to starve this virus. While we may not eradicate it, we know that we have the tools to stop it before it harms the ones we love, especially our children. To promote this, parents will get 3 hours of administrative leave to get their children vaccinated. The vaccine is safe, the vaccine is effective, and the vaccine is free. To view a complete calendar of vaccination clinics, visit dphss.guam.gov/COVID-19. Additionally, for other COVID resources, including pandemic relief, please visit our website at governor.guam.gov. Continue to do your part to keep our community safe, especially with the holiday season upon us. With that, I want to wish the people of Guam a happy Thanksgiving. Please celebrate safely and responsibly. Thank you.
With that, we'll begin questions from the members of our media, starting with Steve Limtiaco, Pacific Daily News.
Yes, hi, good morning. Governor, I had a question about how much longer do you think we'll be in a state of emergency? I mean, it's extended every month, and all of these restrictions now are in the context of a state of emergency. How much longer do you think that's going to be necessary?
Well, if I had it my way and only my way, I would prefer to have it over with. But I cannot tell you, Steve, a definite date. I can only say that we are now in a better position and we are now progressed better. We've now contained the virus much better. We have now medical treatment. We have advanced medical technology that we are using to prevent this. I have no definite date. I will continue to put us in public health emergency as long as we can with our direction and with our information based on science and data. I will tell you that it's not the next month for sure.
Yes, I just had a follow-up question on the administrative leave for parents for the to get their kids the shot. Is that just for GovGuam employees? Is that what you're talking about?
Yeah, I can only do it for GovGuam employees, but I also encourage the private sector to provide the parents with the opportunity and the accessibility to take their children to be vaccinated.
Okay, thank you, Governor.
You're welcome, Steve.
Next, we have Pacific News Center, Gerry Partido.
Yes, thank you. Governor, a number of countries and states in the mainland have adopted this strategy of quote unquote living with COVID, right? In contrast to just trying to level the curve to zero, because they're saying that COVID will not go away and will just become endemic like the flu. Are you thinking of adopting the same strategy or policy for Guam of living with COVID, or are we still trying to, flatten the curve to zero COVID cases?
Our strategy is to accept the fact that COVID will turn from a pandemic to an endemic situation. That's our strategy. Based on that framework, our actions and our decisions will come forth. We do agree, Gerry, and we have, I think, for a while, accepted the fact that COVID is going to be here. Eventually, I think it would be like the flu, because we are now getting more science and treatment that helps us then better contain us and helps us to be less seriously ill and prevents us with hospitalization and prevents us from death. So absolutely, our direction here is based on a framework that this virus is going to be endemic to Guam. And that's why we will continue to evolve and transition to a stand-up environment where we will continue to monitor and test and treat and contact trace our people.
And as a follow-up question, Are we going to get the new COVID treatment pills to to add to our weapons against COVID here on Guam? I think FDA has approved a one COVID pill, and a Pfizer pill is on the way, I think.
Yes, of course, we will get whatever we need to get to protect our people. And once it's able to be distributed and sent or to be bought, of course, we will do that.
Okay, thank you, Governor.
Thank you, Gerry. Mariana's Business Journal, Morgan.
Hey, my question is, what is the next step in lifting restrictions? What's next in the line in the future?
Yeah, thanks, Morgan. In the past, and we'll continue to use that practice with the last two surges, is we would lift restrictions, monitor data, and for about 2 weeks. And once data continues to be, on the downward trend and continues to show that we have contained it, and we of course are monitoring most especially the capacity and the capability of our hospital, we would probably lift social gathering restrictions. We will probably, right now things are open, but we will still continue, Morgan, to mandate wearing of mask for a while, till we see more data and time that we have contained this virus.
Thank you. And then kind of as a follow-up question to that, do you have any opinion or any idea about the mask mandate, when it might go away as well?
When it will go away, I would like it to go away now, but mask mandates, as has been shown, is a very effective way of decreasing respiratory exposure and infections. And I'll tell you this, Morgan, if you noticed, since we have been mandated to wear masks, even respiratory infections have decreased. Flu has decreased. So really, mask is really good. I mean, we could probably look at lifting it once we feel very comfortable that, we're sustained in that environment. But I'll tell you, people will still feel comfortable wearing the mask because of its benefit in transmissions, decreased risk in transmission of infection. Yeah.
Of course. Thank you so much, Governor. I appreciate your time.
You're welcome, Morgan.
Thank you, Morgan. Haidee, Guam Daily Post.
Good morning, Governor.
Good morning.
When will you lift the vaccine mandate for government of Guam employees, or at least a timeline? Because I believe there are still employees seeking exemption from the vaccine mandate. Can you give us an update on this mandate? Thank you.
Right now, I have no decision to lift the vaccine mandate. In fact, boosters are also very important. So we are now at I think 90% for first dose, I believe. But we will continue to mandate vaccinations. It's, again, one of the most effective prevention. And boosters right now is also encouraged. And as Lieutenant Colonel or Assistant General Dr. Mike Cruz says, fully vaccinated is no longer what we want. We want full protection, and full protection involves booster shots.
Governor, just a follow-up. Later on, will boosters become a requirement, a mandate?
we'll have to discuss that with our team, but right now, it's we encourage, and we really want to make it accessible to our people. And so it has been shown that the booster shot does help protect. As you see, as time moves on, there is waning of the effectiveness of the vaccine. So booster has to be part of the requirement.
Okay, maybe unrelated, but will Black Friday be a declared Guam holiday?
No,
Thank you.
no.
Thank you, Heidi. Nestor, KUAM.
Yes, thank you. Hello, everybody. Governor, wanted to talk a little bit. I wanted to talk a little bit about the child vaccinations. How important you think that is? I think the U.S. right now is at 10% after the last 2 weeks. How important is that to your plan, to get child vaccinations?
You know, Nestor, we really want to protect and provide a safe environment for our children, right? And now that we're opening schools and the kids now are in situations where they're exposed massively, I think vaccination is very important. I think vaccination is a very safe and responsible thing for parents to do for their children. You know, we're familiar with vaccines, right? Measles, chickenpox, MMR, all those. So vaccinating our children is not an unfamiliar event. So it is very important to keep our children safe, especially if they are in an environment where there are unvaccinated people. Pediatricians always pronounce that to better protect our children, we need to surround them with vaccinated people. And now that there is the opportunity for children 5 to 11 to be vaccinated, I am encouraging parents to please take your children and get them vaccinated for their protection, because we are seeing pediatric cases in the hospital, and we have seen cases that involves total body multi-system inflammation system that is much more targeted to children, and we want to avoid that kind of serious illness. So vaccination continues to protect our children.
All right, thank you, Governor. And now that you're loosening restrictions, and of course we're heading into the holidays, what is your hope or expectations for businesses and families celebrating the holidays, and how much did that factor into your decision?
Well, the more thing that factors in my decision is, of course, the science and the data. But yes, businesses are totally open. I think lifting of some of these restrictions would allow more activities with our businesses. So that has been a factor in how we can continue to support our businesses by allowing them more opportunities for patrons and customers with the lessened restriction.
All right, thank you, Governor.
Thank you, Nestor. I'll come back around. Steve Limtiaco, PDM.
So yes, Governor. So looks like this latest surge in COVID cases is declining. So in hindsight, is there anything we could have done differently months ago to prevent this from happening at all? I mean, you mentioned today that, you know, too much too soon moving forward could be a problem. So is there anything you would have done differently before this recent surge hit?
Before the recent surge, right, Steve, we were really on our way to, I wanted to just totally open, because we were right there in recovery and we were sustaining our recovery. I think if I was going to do hindsight, I would say maybe much more aggressive education out there. a much more maybe frequent messaging reminders to the people of what they still need to do, because I think for the most part people got lax, right, in their preventive and mitigation measures. So if I was going to say what we could do better, we could probably do a much more aggressive campaign of reminding people and educating them more about the importance of complying with the preventive measures.
Thank you. No other questions.
Thanks, Steve.
Gerry Partido, PNC.
Yes, Governor, just in case, do we have a contingency plan just in case COVID cases surge again after the holiday gatherings?
Absolutely. We will track and contact trace. And of course, if it's clusters, you know, we're going to make sure people are isolated. So, and making sure people are treated, making sure people are given the opportunities to get tested and vaccinated and so forth. We'll continue that. But if the surge continues again, we will have to go back again and, you know, do the whole thing of seeing where it's at, where did it start, what we can do to isolate it, what we can do to contain it more. But we have much more resources, I think, to try and continue a normal life as much as we can.
Okay, thank you. That was my last question. Thank you.
Thank you, Gerry. Morgan, MBJ. Morgan, NBJ, I'll come back to you. Haidee, Guam Daily Post. And also to our panelists, please don't be afraid to respond to questions as well.
Hi, Governor, I just want to clarify what really is the percentage of the Guam population that's considered fully vaccinated? Is it 95% or more? Because the latest census results show that our population has actually decreased from 160,000 to 154. So that means the initial threshold that we had, like it would be different now. So maybe our 90% is now 95%. So what is the full vaccination coverage? And also, are you aiming for a 99% before you could lift most of the restrictions?
Yes, I'll probably have Art from Public Health answer that question, Haidee. But we did recalculate the percentages based on the most recent census that we had. So Art, you want to answer that question?
Sure, absolutely, Governor. Thank you. Yes, to the question raised, our population was adjusted to 153,836, and you're correct, Haidee, we were working at 168,322. But the recent change in our census, with a number of 124,802 who have been vaccinated, we are at 81.13% of our population of 153,836. So we're tracking it very well, Haidee. Thank you.
But that is the total population. But
Yes,
if you do it against the eligible population for vaccinating, you know, now eligible is 5 years old and above. So maybe you can give her that number, Art.
What I have
Are you on
Governor,
mute?
is, I'm sorry, I have 88.13% at that level, ma'am. That's what we have.
For the
right
5 and over. Okay.
Yeah.
Thank you, Governor. So if we reach 90%, will there be additional restrictions lifted?
We are going to be looking at what the data is coming from hospital admissions, and we are going to be looking at what the data is coming from new cases and our CAR score, of course. But the greater metrics here that we look at is the capacity of our hospital to be able to manage if there was again a continued increase in hospitalization and serious illness. So that's what we look at.
Thank you, Heidi. We'll come back around. Nestor, KUAM.
Yes, thanks. I think we pretty much covered all the COVID issues. I wanted to ask you though, Governor, about an economy question. I think the House is expected to pass the Biden bill tonight, our time, and it goes to the Senate, of course. But assuming the $345 million for the hospital remains intact, does that give you more comfort to use the $300 million that you said you're going to set aside for a hospital as maybe a reserve fund in case, you know, the economy doesn't do as well as we think it will do next year, and there are costs that need to be covered?
Yes, it does. In terms of building the hospital, and we were just from the credit rating, if we can build the hospital with as less debt to our people, that would be my goal. And if we can use some of the ARP monies to do that, we will use that. As far as the $300 million for the hospital, we have recalculated that, and now I think it's only $220 million, as we are using some of that for the other programs that we have pushed forward. So my goal here, Nestor, again, is to try, and if we are going to go out there and borrow as less as we can to make up for the balance of and the remainder for the needed funding to build the hospital.
Okay, and do you have an ARP spending plan that you're going to be sharing?
We do. We're probably going to roll it out Tuesday next week.
Okay, great. And we talked to GBB President Gutierrez today. He also mentioned something about a comprehensive tourism plan that you'll be rolling out.
Yeah, he's made a proposal, and you know, there is great excitement about the proposal. I think it'll be good for our tourism, and we are looking at that also. Yeah.
Are you free to share any of the details at this point?
I'd rather wait, but we are being very we haven't yet looked at all the details. The concept is to shift tourism attraction to more cultural, as surveys have been made about the behavior of tourists now, Nestor, and they're shifting more to learning more about the culture of the destination that they're at. So I can only say that it is a proposal, I think, that shifts some of the attraction for our tourists.
All right, thanks, Governor. Happy Thanksgiving, everyone.
You too, Nestor, thanks.
Do any of our reporters in the room have any outstanding questions? We do have a very experienced panel.
This is to the governor. Gov, do you have additional jobs creation programs that will hire massive unemployed Guamanians? There have been job fairs from GovGuam and private sector, but the numbers do not offset the unemployment of thousands from the tourism sector without the tourism industry to count on in the near future.
Absolutely, Heidi. With this infrastructure bill that the president has signed and is going to be effectuated and implemented, we are looking at increasing job opportunities in the hundreds. And we are looking at increased demand for construction, increased demand in planning, increased demand in all those ancillary careers that connect with what we are going to do with the infrastructure bill, and that is to fix our roads, fix our utilities, provide more transportation accessibility to our people, and provide more internet broadband opportunities to our people. So those are job creation opportunities, and we continue to work very closely with GCC, with UOG to provide apprenticeship programs, pre-apprenticeship programs, and training programs to again shift the skills of our people from dependence on tourism over to diversification of the economy. And we are using also our ARP in that sense. And just want to say we are always going to be flexible about responding to the needs of our people and our economy.
And Governor, recently the Guam Chamber of Commerce said that they will continue to push for a rollback in the business privilege tax from 5% to 4%. Have you changed your mind about this?
No, I have not.
Governor, what again is the reason for not rolling back the BPT?
First of all, if you look at the numbers that we are tracking, BPT revenues are still way below what the projected budget is. And so it's still not making up for the loss in revenue as a result of the Jobs Act of President Trump. Secondly, I just want to let you know that between 60 to really 80% of small businesses don't pay 5%. They really pay about 3% because of the Dave Santos Act. So we still need to have the funding revenue source from our businesses, and that's why I am not at this point supporting rollback of the 5% BPT taxes.
Thank you, Haidee. As always, an executive order will be signed to explain all the lifting of restrictions as well as public health guidance to accompany. If there are no further questions, thank you everyone for joining, and please be safe. Or actually, Colonel Cruz, I'm sorry, just logged on. Would you like to give closing remarks? Thank you so much, everyone. Please be safe.